Hey everybody, a lot of times when you go on to testosterone replacement therapy, you're probably going to get prescribed a testosterone that comes in a glass ampule. Like with us in the UK and in Europe, many of us are on Sustanon, which comes in a 1 ml ampule. Now, when you do your injections, you may not draw up all the testosterone in one go. For example, some of us might only inject half an ampule for our injections every time we do an injection, right? So a lot of guys have got questions about this. They say, well, what should I do with the other half? Should I throw it away? Or should I inject it in a syringe and store it and use it again another time? And so there's a bit of confusion around this. And so today I just wanted to clarify that and give you shine a bit of light on the situation to help you make that decision a bit more better. So officially, according to the doctors, they are going to tell you that you should toss the remainder of your testosterone. They're going to cite things like safety precautions, because if you draw up the whole solution and then you only inject half and then maybe swap needles and you store it, for the next time, maybe when you're injecting that first half, as you pull the needle out, it's possible that contaminants may get drawn into the syringe and then sit there while it's being stored until the next time. And I'm sure there's other reasons that they give for why you shouldn't do it. I think personally, one of the main reasons is they just want to cover their own asses. So for safety precautions, just in case something does go wrong, they tell you to throw away the remainder. Now, to those of us that are practical and think about things, that does seem a bit wasteful, right? If you're tossing away something that you paid for and you use half and you throw away the other half, that can be wasteful. Or for someone like myself who prefers small injections of only a quarter of an ampule at a time, then you have to throw away 3/4, and that doesn't seem practical or financially viable either, right? Especially when you're paying a sort of premium price for your testosterone through a private medical provider. So according to the doctors, you should toss it, right? And that is good advice, right? The doctors are saying this for a good reason. So if you want to play things on the safe side, then you should follow that advice. However, if you're someone who believes in personal freedom and taking responsibility for your own actions, right, then I can say so far that I've never heard of anyone in the community or of it happening personally to me where you have drawn up the testosterone into a syringe and then maybe only injected a quarter and then swap needles, and then the next time injected another quarter or another half and then swap needles and so on, right? Sure, they tell you that you shouldn't do this, but if you take personal responsibility for yourself and your actions and you understand that there may be risks involved, you are prepared to take those risks on board and then deal with the consequences should anything go wrong, then really that decision is up to you. I'm not going to tell you what you should or you shouldn't do. I'm just going to say that there's a risk to reward line here that you've got to consider. And if you're willing to do that and take responsibility for your actions, then what you do in the privacy of your own home is up to you. So officially, for the record, they're going to say, toss it. People like myself and many others in the community may decide to go another route, right? But that's completely up to you. Just understand that there are risks involved, and if you're prepared to take this on board, then go for it. It's your life, your health, and what you do behind closed doors is your business and nobody else's. So that's all I wanted to say today. Some of the doctors in the community are probably not going to like this advice. I don't care. I'm telling you officially you should throw it away, but I'm also telling you there's many guys out there that aren't doing that, and I've yet to hear of a situation where something has gone wrong because of this. Does that mean it hasn't happened? No, maybe it has happened. Me personally, if I'm going to make a decision like this and something does go wrong, I take on that responsibility and I deal with the consequences and I own it fully, right? I'm not going to blame my doctor. I'm not going to blame anyone else. I've made the decision, so I have to deal with the consequences. And I think if everyone else approaches it that way, then the ball is in your court and the decision is up to you to make. It's certainly not the doctor's responsibility if you go against their instructions. So I hope you found that a little bit more insightful. And to those of you that are asking this question a lot, I hope that helps and gives you a bit more context to it. So that's it for today, and until next time.